This is chapter 6 of my journey to defend myself against prostate cancer using the Durham VA medical facility. Dr. Salama, I understand the challenges of administering a department. I have administered a 700-bed hospital respiratory therapy department, along with multiple businesses with hundreds of employees, and lectured thousands about business and personal development. I believe the staff at the oncology department, they're doing the best they can. I also understand procedures can go amiss regularly. That's why there are over 300,000 recorded iatrogenic deaths each year in the United States. Having worked in the ER and OR, I've seen human error cause immediate and irreparable damage. There's a reason no one leaves the OR until every sponge and forceps have been accounted for. As a business owner with directors and investors, I have a fiduciary requirement to provide healthcare information in a timely and accurate manner. So when I am the subject of a failed healthcare system, I'm forced to advocate for myself. For nearly 8 years, I've been asking for compassionate care and respect from the VA Urology Department under Dr. Gingrich. I've been dangerously berated by his staff while driving, told an MRI was too expensive a procedure for prostate cancer diagnosis, and been refused VA appointments with no explanation. My referral to Dr. Lee came from the Duke University Cancer Clinic and Dr. Robertson, who performed the MRI-guided biopsy. This was the procedure I requested and was denied by VA urologist Dr. Gingrich over the past 5 to 6 years. During that time, my PSA rose from 5 to 6 to 17. That should never have happened. Had I had the MRI-guided procedure done over 5 years ago, the treatment would have most likely been a HIFU procedure on a much lower Gleason score. That delay in treatment is under state and federal ethics review. When I was seen by Dr. Gooding, I was told there was no written treatment plan available for me to view online to track my requirements and progress. I was given a drip of information that was extremely limited and given verbally. As it turned out, the verbal did not match what was ordered for my treatment. As for my own advocate, I recommended Dr. Gooding consider a PET scan versus a simple bone scan to expose any metastasis. He agreed and amended the radiology requisition to a PET scan and ordered meds, including diazepam, as I requested. During a phone conversation on 17 June, Dr. Gooding conveyed the negative metastasis impression from the PET scan. We discussed the upcoming treatment procedures. I requested the upcoming MRI be completed at the Duke Hospital since the machines allow upper extremities to be outside the tunnel and therefore require no claustrophobic medication. His suggestion was to cancel the MRI as a solution to the claustrophobia. I felt bullied and agreed to the procedure at the VA radiology. He explicitly expressed he had ordered diazepam for the upcoming MRI. When I arrived at radiology, they said I had to go to the pharmacy to obtain the diazepam. The pharmacy stated they had no order from Dr. Gooding for that day and that he was unreachable and therefore there was nothing they could do. For me to decline the MRI at that point would have delayed my treatment even further. I was left feeling traumatized, disrespected, and ignored. No one from oncology has contacted me about the 17 June MRI impressions, and there are no notes visible to my online access. There was an obvious failure in the treatment protocol. I have upcoming procedures for which I have not adequately been advised. I requested an appointment with the resident replacement for Dr. Gooding since he has completed his rotation. When I received no response, I requested an appointment with Dr. Lee, my physician. I have left messages at the clinic for callbacks with no response. I've been ignored and ghosted for either appointment and forced into treatment from a failed system, leading to health-damaging mental anxiety and physical trauma. Here are my recommendations. Currently, with the MRI radiology report, the resident's findings are verified by the radiologist. I recommend oncology resident orders be reviewed and verified by the department head or the patient's attending physician. Patient care and safety should be paramount. Similar to other VA departments, all lab and radiology results should be available online to the patient with resident comments and instructions. Other departments mail the results with their comments to the vet as well as posting online. This can easily be completed through My Health messaging. Patients need to be warned and prepared for delays in treatment when the attending residents are unavailable at the time of procedure. They may have drivers with them and their lives could be disrupted. Appointment procedures and messaging needs to be reviewed. Telling the patient you have a new resident should be standard communication. When the patient asks for an appointment, the response needs to be more rapid. Cancer patients have healthcare anxiety and deserve empathy and compassion. Treatment procedures need to be written and given to the patient at the beginning of treatment. Patients deserve to know what procedures to anticipate, their timing, and what to expect. Knowledge of treatment parameters lowers anxiety and improves outcome for both the patient and the caregiver. Finally, please read this book, Wonder Drug: 7 Scientifically Proven Ways That Serving Others is the Best Medicine for Yourself. Every healthcare provider needs to read this and reread it at least once a year. And please have a scheduler provide a time on Monday, July 25th to My Health messaging for the attending resident to call to review upcoming appointments. Thank you.